Hello, my name is Dr. Mauro Zappaterra, and I am the medical director of our functional restoration program here at Synovation Medical Group. And today I wanted to interview one of our patients who has recently undergone the program and ask her a few questions of how she benefited from the program, what her experience was of the program, and just get a patient perspective of going through the program. Thank you very much for
my pleasure
coming here to do this interview.
It's like coming home. Why I'm here today and why I wanted to share this is because you get a sense of community that people in pain don't usually have. A sense of people to care for you, not only the doctors that work the program, but the people who are in it with you. You have a sense of purpose to get up every morning and go somewhere and be accountable for your own health and well-being. And I think that as a patient for a year, I didn't have that accountability. I kind of took my diagnosis and just dealt with it, but I never was in charge. And this program put me back in charge, back in the driver's seat. And then it taught me how to utilize my mind to create a more pain-free existence for myself, through meditation techniques, through some of the psychological work we did, a better understanding of how I might have pain, but the suffering is optional, which is one of the key phrases I keep reminding myself on a daily basis. I feel like it gave me my life back, and I would heartily recommend it to anybody who has been taken off the tracks of their life for whatever reason, because it is hard without people holding you up to get where you want to go. And this program gave me those legs.
Beautiful. And so I just got now that you actually renamed the program.
Unofficially, of course. For insurance purposes, it is a functional restoration. But what it did was help me fully realize my potential, because I lost myself in that year of illness. You know, illness is depressing, pain is debilitating. I don't know anybody who goes through it as gracefully as they would like. You deal with it and you handle it, but this gives you the tools to go out into the world and begin again. And I feel like I've had a rebirth of sorts.
That's amazing. So it's fully recognizing
my potential.
Your potential.
Yeah.
FRP?
FRP.
we have a lot of patients asking us, what is the program? Do you have a sense, if you were to use your own words now that you've gone through the program, what is the program?
The program is a very special way to create that mind-body connection, or help you reestablish that mind-body connection that allows you the dignity to take control of your life. And it does it through physical and mental and meditation. I've learned a lot. I still have my notebook. I'm going through the pages. I love that I have 5 different meditations I can pull on or access if I need to. I've got reading material. I've got source material for other things if I'm interested in pursuing them. So I feel like I was given a jump start into the next phase. I figure I'm going to be on the planet another 20, 25 years.
Nice.
And I have to have something to do, and this really was that startup for me.
Nice. One of the things that we talk about is trying to give patients their own toolbox, that when they're walking around or sitting or interacting socially, that they can have tools that they can go to in case their pain increases, or let's say they have a negative thought. And when you go to your toolbox, the more tools you have in the toolbox, some may resonate with you, and so you can actually go to that toolbox, pull out the tool, use it yourself. Do you feel like you've been given a toolbox, or your tools in that toolbox have increased by going through the program?
I definitely have a toolbox. You know the experience I had. I had back spasms and went to the emergency room while I was in the program, and it was over a weekend. And the first thing I did was my mindful meditation. I had my feet on the ground, I was meditating, and I got through the hour I waited to see somebody in the emergency room, much more comfortably than I would have been if I had just been in angst about it.
Nice.
So, yeah, the toolbox works. You have to work the toolbox.
Yeah.
You have to open it up, take it out, and put it to work. But if you're willing to do that, you leave with what you need to recapture your life in any way, shape, or form that you want.
Wonderful. Any final comments?
I would recommend it to anybody who has really had to confront, and it's when you are injured or in pain, you are not just dealing with that one specific area. You're dealing with a whole body experience, and your whole community is dealing with that experience with you. I didn't know I was a groaner. People had been telling me I'm groaning a lot because I'm in pain. I stopped groaning after we talked about it the first day. I don't know why. I think because I had other things to do with my time. So I don't think that people in pain necessarily take that responsibility on for themselves and think they have that power. And what I love about the program is it gave me back that power to realize that I have a choice. Again, I'm not going to suffer if I don't have to.
Nice. Thank you very much for...
Thank you for everything. It's been a privilege to be here for 4 weeks.
Great.
And I would recommend it to anyone.